the topic that we started last time, that was developing communication competencies. And that's a very useful basic topic for any healthcare professionals, because the nitty-gritties are very simple, but we normally overlook them. And at times we consider that they are not required in healthcare setup. And we assume that they are fit for any, hospitality industry or some, like hotels or event management or something where people are more, particular about the etiquettes and other things. But that's not true. I think last time you must have realized that those smaller, finer details really help in building good rapport with the patient, winning their confidence, developing their trust. So this topic I normally integrate with almost every session that I take with the healthcare professionals, because a lot of their, the management's concerns get resolved. Like, for example, about dressing when we talk about, or for example, facial expressions, that we do work but we don't smile. Or for example, when you're touching the patient, touching it in a respectful manner, and also making sure that the patient is comfortable. So all these small things, ultimately they add to the overall, enhancing patient experience. So you must integrate this in some way or the other with your sessions when you do it for your clients. So any point that you wish to ask or say from the previous session?
Ma'am, maybe if we have time at the end of all the sessions and we have like 15 minutes that we can spare on the topic of using or utilizing nonverbal communication in situations where violence um, either it is broken up or it's about to, I mean, it's going in the wrong direction.
So beauty, one is I'm going to talk about nonverbal communication in the next this thing, immediately after this discussion. And second, I'll also be talking about how do you handle difficult situations with assertion. So I'll be first sharing the theoretical part of it, and then we'll do a demo. We'll do a role play and a demo around it. So I think that will give you a lot of clarity on how do you train people in handling difficult situations by staying calm, firm, and still polite with people. And how do you? So we'll be doing that. And I remember, Dr. Samira, you had asked for that particular one thing. How do you ask for patients' expectations? So that was your doubt, that it is something that we normally are not used to. And I completely understand, because here we don't consider patient as equal to us. In our countries, we think patient is like us and we will decide what we have to give you. Patient's expectations has nothing to do with what I do or how I handle. So I'll try to give you a couple of, again, demos to tell you how we can, in what way can we check patient's expectation. And in case if we find it unrealistic, we need to address it. And how we do it, we'll talk about it. I'll spare at least 5 minutes for that, in this session. So moving forward quickly, we discussed about communication style. And Bindu, I think you're familiar with that questionnaire that we use for communication style. So we checked everybody's communication style, and it was visible that most of us use assertion as the primary way of handling situation. But usually when the things are not in our control and situation goes out of hand, then we, move to another communication style. And for each one of us, that could be different. We can become aggressive, some of us become passive, some of become passive aggressive, or depending upon the situation, depending upon the person we are interacting with, we pick and react. Like, for example, if I'm dealing with somebody higher in hierarchy, I know there's no point becoming aggressive and I would be on losing the ground. So I would either become passive aggressive, or I choose to withdraw and become passive. And I think all of us had this realization that yes, we all use this technique in our day-to-day communication, and just not in professional setup, even in personal setup, this is what we do. So taking it further from here, although I wanted to discuss at length about different communication styles and what are the advantages and disadvantages. So even communication style itself can be one full topic for you when you conduct your trainings. If you get a chance, even in the hospital setup, with your leadership, with team leaders, with the hospital staff, If you just give them this questionnaire and hold discussion around it, that where does the communication break? The moment we become aggressive or we become passive or passive aggressive, communication breaks. So that is where we have to help them realize that in all probabilities, we have to stick to the point to assertion. And in case if that is not working, park it, give it a pause, move away from that situation, let somebody else handle it, but don't move to another style. Otherwise, the direction of the interaction would go haywire. Just 1 second, I think she's trying to come. Yeah, good lead is there. So taking it further from there, I would just share what is assertion. I think that if we have clarity on it, then we will know how exactly we have to handle it. Yeah. Hi, Gurleen.
Good evening, ma'am. I'm so
Good evening.
sorry, everyone.
That's all right. Yeah. Yeah. So as I was saying, see, every communication has major 3 things. One is your language. Second is your paralanguage. And third is your body language. So when you assert, first thing that you have to remember is that your language should never go down. The level of your language should be there. Like, for example, if you are used to saying aap, stick to that point. Never go down to tum. The moment you will go down to tum and tu, the other person will also come down to that level. So, for example, if I'm angry and I'm arguing with my staff or with my patient, and I say, "तुम ऐसे कैसे बोल सकते हो?" Chances are patient will also say, "तुम भी तो ऐसी बात कर रही हो." Dr. Samira, are you understanding what I'm trying to say? No, I'll explain. So what happens? In English, we always say you. Even when we are angry, unhappy, happy, we say you. But in India, there's a respectable word called aap. That means you with yourself. Aap is more like yourself. And when we say tu and tum, that's like you do it. You have done it. So one thing that we have to always keep in mind when we are, interacting with people, our language has to be exemplary. It has to maintain its decorum. We cannot use foul language. We cannot use cuss words. We cannot use derogatory language at any point of time. Please remember, if you will keep your stand of language at a place, that means you have already doing one thing well. Now, is it clear, Dr. Samira, what I've said? Okay. The second part is paralanguage. And as I said, communication is not what you say, communication is how you say. So 93% of the communication happens through paralanguage and body language. And 38% is the tone of voice, your speed of talking, volume, and everything has a role to play. So when you are interacting with people or discussing or negotiating, or there's some difficult conversation happening between you and the other person, make sure that your tone of voice is firm but friendly. The moment your tone of voice is little rash or rude or authoritative, you are not asserting, you are aggressive. So we have to remember that my tone of voice has to be, and I'll give you a demo after this. I'll give you a demo so that we clearly know what I'm trying to say. So tone of voice has to be firm, because if you're not firm, then the other person will not take you seriously. But at the same time, you don't have to be rude or authoritative or loud. Second is your speed of talking. So when you are having a difficult conversation, it's always good to either stay on the same speed or rather slow down. Slower you will speak. One, you will get a chance to think and speak. One. And second is, you will be taken seriously when you speak slowly. Why do we like Amitabh Bachchan's voice? They all have, voice training. All of them undergo voice training. They're not born with this style of speaking. They've acquired it by training. So the speed of speaking has to be either same or maybe little slower. It'll have more impact. Then is volume. Again, the volume has to be normal or modulated but it should not go high. The moment the volume goes high, the focus shifts from the content to the delivery, and it will appear to be aggressive. So these three things we have to definitely take care of. The tone of voice has to be, either normal or maybe, but firm. And speed has to be either same or maybe little less. And the volume has to be like we are talking right now. Third is body language. Most important in the body language is your eye contact. So when you are asserting, you must make eye contact with the person. Because when we avoid eye contact, we are not sounding very confident. It also may appear that I am avoiding the, interaction. So you must make eye contact, but eye contact should not be arrogant, rude, authoritative, intimidating. We have to remember that eye contact is just to communicate that I am talking to you and I mean it. But not with the idea to scare the person, threaten the person, or to show the authority. Does that make sense? Okay. Besides eye contact is your facial expressions. So facial expression should be firm, because when we are asserting, we can't be joking. I mean it. And then we can't be joking. But at the same time, facial expression should not show anger or aggression, because that can threaten the other person and that person will close down. Third is, when you are asserting, it is always a good idea to sit and talk. Because when you are standing and talking, it appears more like, being aggressive. It's better if both the parties are sitting across the table. In case you are not able to sit or the other person is not ready to sit, then both of you should be standing. But one person sitting and the other person standing is not a good idea. The person who is sitting will have to look like this. So again, it's going to put strain on the back of the neck. The person has to look down, will have to look down like this. Again, it will put strain on the neck. So it should always be eye to eye contact, and you should be at the same level. Again, your hand movement, your body language should communicate that you're relaxed. In case if your body movement shows that you're aggressive, or you're, you are upset or you are scared, again, it will not have the right impact. So if you are able to look after these three things, the impact of what you're saying multiplies number of times. And this is not just in the work situation, even at home with your family members. This is one skill we are not taught. So we don't know how to assert. But this is one skill I think we should know, and we should teach our children and everybody, because that's how you can communicate how serious you are about the issue that you're addressing. And you want the other person also to take you seriously. So we can have a quick demo around it if you want, so that we learn how do you go about. So would you like to do the role play between you, or you want me to give a quick demo? What is your choice?
I prefer you do it.
So we do the
you can give the demo.
Because of time thing.
Yeah, that's what
Better
was
you
because
just-
otherwise I would have loved having role play from you and then having a demo, but then that would take away a lot of our time.
One
and-
class will be for that then.
Exactly. I told you.
Yeah.
Communication style, full one session, I think. But what I will do, I'm going to club one topic with this so that we don't lose on time, but we take. So we'll take a situation that you remember that patient Ram, who had pulmonary coughs and developed pneumonitis, and the family is worried. They have spent 5 lakh rupees. The patient is already in ICU. The condition is not improving. So assume that the patient's family want to take the patient Lama, that is left against medical advice. Understandable. They have spent 5 lakh rupees. They've already spent a lot of money. Maybe they have no money or they are short of money. And the family has decided they want to take the patient. Also, they are not very happy with the way we have handled them. That's the usual complaint we receive. Am I right? That I was not updated properly. I was not, informed about the things, and I was not given an opportunity to see my patient. And the doctor did not give me enough time and explain. These are usual complaints. Am I right? Okay. So I want somebody to act as a family. Two of you can choose to be the family members who can actually be as aggressive as you want, as rude as you want. I mean, anybody who has good confidence in it that I can act rude, raise your hand. You got to. We are doing a role play. We are going to learn how do you handle aggressive people by staying calm. Okay, Bindu. Bindu, you have to be as rude as you want. You can say anything that you want.
Will
And
try
Dr.
my
Hemant,
best.
Dr. Hemant, will you?
I'll try.
No.
haven't
You
been.
raise your concerns. You raise your concerns, the kind of concerns you hear from your patients. So you are in hospital industry, so you know the kind of cases you see every day and you are managing them. So I assume that I am a doctor sitting in the ICU. I'm on duty, and Bindu, you are, we can take like you are daughter to the patient. 65 years old man. You are his daughter, and Hemant is his son. Okay. So we keep the same name, or you want me to change the names? Yeah, I call you Bindu and I call you Hemant. Is that okay?
Fine.
Okay. So can I request all others to switch off their videos and we three will be visible and then we can come back. Achha, there's one thing more I wanted to share. That is observation. But I think, again, if I'll go into the observation inventory, then we'll take longer. And I want to keep it as short as possible. So if you can.
Reminder for the group photo.
Oh, but it's okay. Let Dr. Santwana come to the,
Yeah.
then we
Yeah.
will do.
Yeah.
Yeah. Okay. So all can actually, yeah.
Another 2-3 minutes, please.
No problem. Okay. Fine. So both of you assume that I'm sitting in the ICU and you have come from the door inside. You have asked the security guard that we want to meet the doctor, and you are in my visual field. And you have to stick to the agenda that we want to take our patient. Okay. We want to take our patient. That's the agenda. Okay. And you can be aggressive because I want to show that even when you're handling an aggressive patient, how do you still stay calm and assert whatever you have to say. ओके हाँ जी, आइए आप हेमंत, आप नीरज जी के पेशेंट है ना?
जी डॉक्टर साहब, मैंने बहुत सुना था हॉस्पिटल के बारे में और बड़ी उम्मीद लेकर आए थे, लेकिन जिस तरह से हमने उनको मिशन किया, सारी फॉर्मेलिटीज पूरी करी, एडवांस भी डिपॉजिट करा, लेकिन कोई इम्प्रूवमेंट तो खैर दूर की बात है। कंसल्टिंग डॉक्टर ने अभी तक केस देखा भी नहीं और ऑलमोस्ट 12 घंटे हो चुके हैं। तो मैं कैसे ट्रस्ट करूंगा कि यहाँ पर मेरे फादर की जो लाइफ है मतलब ठीक रहेगी यहाँ पर? आई कैन ट्रस्ट। आई वुड लाइक टू टेक देम टू एनी अदर हॉस्पिटल।
देखिए हेमंत जी, ऐसा है कि मैं समझती हूँ कि जब पेशेंट क्रिटिकल कंडीशन में हमारे पास आते हैं, आई एम सॉरी, आई थिंक आई हैव टू स्पीक इन इंग्लिश सो दैट समीरा कैन अंडरस्टैंड। So, Hemant, I understand your concern completely, and I can see that you're quite upset. And I'm sure you being upset is very genuine because one, your family member is in a critical condition, and second, you have not been updated. I completely understand. But see what happens once we have a patient in serious condition and in the ICU. Our focus is on attending to the patient. So sometimes we kind of do not pay so much attention to the family. I apologize for that. I completely understand. But if we haven't been able to interact with you, trust me, in terms of care, I think we haven't gone wrong anywhere. Your patient is being
But doctor, do you realize we have invested all our savings on it, and we are, doing everything you want, any test, any MRI, everything we are open to it and agreeing, but your doctors, they do not respond to us. We run after them and they pay no heed to us.
Bindu, I completely understand your concern again, because I know you want to be updated about your patient's condition. So usually what we do, morning, evening, 2 times in a day, we update the family. I personally call the primary caretaker, and I know I have met Hemant last night also, and today morning also when he came, I talked to him, and I did update him about your patient's condition. But definitely, I understand his condition is serious, and you all are, I understand we never have any extra money kept for healthcare. None of us have that habit of saving some money for healthcare. So usually whenever this thing, something like this happens to anyone, it's very painful for anybody. Had I been in your position, I think I would have been in the same state. But at the same time,
Doctor
yeah,
Saab,
yeah.
even he has been advised MRI, but I don't see 4 hours have already passed and no effort have been taken to get his MRI done. You don't have the facility of it. We understand this. But can't there be arrangement of an ambulance team to get his done? How is treatment will get delayed on reporting, and the neurologist himself has told him without MRI will not be doing further this thing. So you can understand and nobody is saying heed to that question of it.
See, for the MRI, we are already in talks with the place where we normally get our MRIs done. The ambulance is on its way, and I think anytime the driver will be here and will be moving your patient on priority to get the MRI done. Meanwhile, we have already started with the treatment that we think is required in this case, although MRI will confirm it further. But in terms of treatment, we haven't delayed the treatment for the weight of MRI. Everything that
But doctor, all said and done, we want a discharge from your hospital. We would like to explore another place. I mean, we are not convinced. We are not.
So,
I
Bindu,
mean, we
where would
don't
you
have
like
good
to take your
vibes for this place anymore.
Yeah, where would you like to take your patient?
We are discussing with our other friends in other hospitals. I mean, we are looking for a better place where there is a promptness and where family can be addressed, and the patient, we want him to be in safe hands, moreover.
So, Bindu, I can only say one thing. See, it's your patient, it's your call. I cannot force you to agree with me. But what I would like you to understand is that the condition is really not that good to transfer him in this situation, especially he is on ventilator. So, in case if there's a patient on ventilator and you are moving the patient to another hospital, it takes good 4 or 5 hours to actually reach to another hospital. If you want, I can make a small summary of the patient's case. You can take that summary, discuss with the hospital you want to shift, check with them. If they say that what is being done is sufficient, I think at least that part is taken care of, because moving is not a very good idea at this moment. That is one.
We have arranged
Hemant, allow me
for
to
the
complete. Will you please allow me to complete? Yeah. So that is one thing. And second thing is, if you want me to speak to anybody, like for example, if you have a doctor in the family, you have a friend who is a doctor, if you want me to speak to him or her, I'm more than happy to, address your concern. Because treatment wise, what I want to tell you is, treatment wise, your patient is being looked after by the best treatment guidelines. Whatever the standard treatment guidelines are, we are following that. I'm ready to give you the small summary of the patient's condition and what we have done. You can discuss with your doctor or where you want to take. And if they say what is being done is right, I think that addresses your major concern. When it comes to addressing your concern, I can understand your this thing, and I'll make sure that we update you at least twice in a day. I can address that. But if you still wish to take your patient, I'm perfectly all right, because that's your call. I am ready to, give you your papers with you. Only thing is, once you are taking the patient against medical advice, you have to actually, sign a document, and that's called, left against medical advice, because that's a formality, but that has to be followed. You can arrange the ambulance, and it will not be a regular ambulance. You will have to bring a advanced ambulance which will have all arrangements for the ventilator and other thing.
We'll take care of that. Earliest by when can you provide us the summary?
I can give you within an hour. Check with the hospital, do they have the bed? Because at times what happens, you move the patient from here and you go there and you realize there's no bed. Because once I move your patient out, this bed gets occupied by another patient, then even I may not be able to give you a bed unless I have an extra bed. So I think you need to discuss with your family, check the pros and cons of your decision. If you still wish to go, I'll give all my cooperation to you. Is that okay?
Fine. Give us 10-15 minutes to discuss and we'll get back to you.
You can come. You can discuss and come.
Thank
Thank
you.
you.
Thank you, doctor.
Thank you.
So can I request all others to have their video on?
अब इतने तमीज वाले डॉक्टर को क्या तो लड़ाई हम क्या एग्रेसिव हो जाए बड़ी इच्छा हो रही थी इंदु दी नहीं हो पाया
This is what I normally tell, that this is how we have to maintain our composure. Stay calm. If they are asking for second opinion, it's their right. Why not? If it was my family member, wouldn't I take a second opinion? Rather, I'm voluntarily telling you, I'm ready to give you a patient's summary and the summary of treatment. Show to your doctor. If he says he's going to give something different, I'm more than happy to give you a patient. Second, if that's your concern that the patient is not being looked after, that concern gets satisfied. Second is your concern that nobody's updating this, which is something we can address. I can make sure that you are allowed to see your family member. I can make sure that you are you're attended and you are given patient's update. So what do the other group members think or feel or want to say about this? So if I ask you to comment on the Dr. Santana, I'm coming to you. So if I ask you to specifically comment on first thing, that is my language, I think that will be a better way of giving your feedback. Did I ever anywhere go wrong on my language?
No.
Did I use any foul language, derogatory language, disrespectful,
No.
rude?
No.
And sometimes when you ask somebody to Dr. Hemant was trying to intervene, and then you said that, he should allow you to speak. Sometimes that can also be taken as an offense.
Again, how you
Yes.
said with beauty. Please let me complete. Let me complete my work. And if I say, please allow me to complete, I'll come back to you. It is not what you say, it is how you say.
Yeah, that's ideal, probably.
Yeah. It's something that can be learned. We have not been taught, so we don't know how to behave. That can be learned. That can be different. Second was my tone of voice. Did I go wrong on my tone of voice anywhere?
No.
Volume,
Volume was perfect.
speed.
Speed was okay.
I'm specifically pointing out to this because this is what I want you to remember when you do role play, because you will be giving demos. To start with, you will have to give demo and then they will give you a return, role play. They will act for you. But you will have to give demo in the manner so that they are exactly able to see. Now coming to my facial expressions. Were they rude, authoritative? And if you saw constantly, I was nodding my head. When you nod your hand, that shows that I'm listening to you. I'm understanding. I'm getting what you are saying. Then I was trying to reach out physically. Slightly.
Bent.
Yes, sir. Yes, Dr. Hemant.
Yes, ma'am. Everything went well. But initially we approached
Some
and,
challenge on your voice. This some what do you call it? Additional sound. It's not very clear. What is the reason?
Distorted. Yeah.
very network bandwidth is low.
No, it's not network. It's your earphone. I think there's a possibility that there's a Try once again. Yeah. Ji. Yeah.
Initially came to know when attendants are coming, and we know by observing that they may be having issues and want to lama, or they have got some cause. So the first thing which we practice is the moment they come. So often they may sit, to sit, and then you can speak.
Yeah.
So from that, it sends a good one that okay, they are ready to listen to our vote. Generally fixed duty situation. Otherwise, so that is one which we can actually have given result.
Yeah.
So offering ways to it, and then we
Yeah.
can avoid.
Definitely. Sure. Dr. Santana, you had something to say, please.
Yes, ma'am. Ma'am, what the wonderful act that you all did right now was actually, I would say, around 18 to 20% of issues that come up. Like, so these were much polished patient relatives who were talking to you, and this was on a subject which could have been handled. Most of the time, I would say that 50% of the issues generally arise when it comes to the billing part. Okay, wherein like, of course, even them, they were charged 5 lakhs and they were very upset about it. So, and patients, they come very furious. Both of them, Dr. Bindu and Dr. Hemant, were very, very okay kind of a thing. But if I would have played the role play, I would have shown that how the patients come. That's why I did not this
Raise
time.
your
I said,
hand.
hold on, I'm not going to.
No. Yeah, Dr. Hemant, you want to say something? Yeah.
There will be people from, I always say, how daily touch. It will be not by their actions or something, but their
Dr.
words
Hemant,
and their.
I'm not able to hear anything. I think you log out and log in, because maybe there is a network issue. Try logging off and log in once again. Yeah. Gurleen, you had something to say.
Yes, ma'am. I actually wanted to add on to what Beauty said. So I think there's a technique called hedging. And in moments like this, if you can add some softness, so just saying something like, if it's okay, or if you don't mind, is it all right if I can just interrupt you for a second and then I'd come back to you, or something like that. I think those can be incorporated.
Yeah. Thank you. Thank you for adding. Thank you. So, Dr. Santana, what you were saying about billing part. One is, I think we need to be more transparent and honest in our billing. If we are not that, every day you can expect n number of, fights in your hospital. If I'm doing that, I have to face the music. That is one thing. Second, on billing part, I think why not give accurate estimate to the family so that they are mentally prepared for paying, because nobody has kept an extra fund for healthcare. I think unfortunately we are not in habit of saving like this, and most of the people do not care for having a medical cover also. Third is, billing means, if every day if I make my patient and the family pay regularly, then at the end you are not left with a huge amount. So that later on, even if there is a conflict, it is not about the total money, it is about the part of the money. Most important of all, when I'm prognosticating to the patient, I must be able to explain that money spent is not equal to guarantee of life. I have to make it very clear. When Bindu was saying we paid so much, then my answer would be, I understand in private setup, you will have to pay for these services. But what I can assure you, they didn't ask me for guarantee. They could have asked me for guarantee. That give me guarantee, we are paying so much, our patient should be safe. So my answer to her would be, I can assure you of the best possible care to your patient. But I cannot guarantee you the outcome, because I have no way to find out I can assure you whatever the standard treatment guidelines are, we are following that. You can get it verified by anybody. But at the same time, paying money is not equal to guarantee for life. And I'll give you a chance to act the way you like to act, and then we will have a small role play again, if time permits. 1 second, I think Dr. Samira had something to say.
No, thank you very much. It was so beautiful role play, and you were so empathic with the patients. You used many empathic statements. I think they are very useful. Thank you.
I think one thing that we have to remember when we are dealing with the patient, we are not two parties. We are one party. If you can create that, and there is no point faking. If you are not two party, even if you fake that we are one party, they can make out that you are not one party. So you have to be honest in your approach. And if you're honest in your approach, that is visible in all your body language, verbal, non-verbal, everything. And it comes out. So I think that's something that we have to really, inculcate in our healthcare providers. And we usually do not pay much, importance to these things. That's the thing. Dr. Hemant, you had something to say.
I just wanted to correct it all right, ma'am.
बहुत
Again issue. Actually, there is some issues with the network. It's coming.
So, अगर आप
Can you remove? I'm sorry, ma'am. Can you remove your earphone and try to talk directly? The possibility the earphone pin is not getting connected properly to the laptop, and that's when this distortion takes place.
Try once if it
We'll
works.
try. We'll try.
आप कोशिश करिए. अब तो बिल्कुल आवाज ही नहीं है.
I think he's on mute.
No, he was not on mute, but I think the settings have to be changed from headphone to internal speaker. Yeah. So meanwhile, Renuka, what do you have to say for the role play?
Yes, ma'am. Good one. Lot of a calm, composed way of handling the patients, as Samaira ma'am said. Like a lot of empathic statements came. Yes, I did miss Santwana ma'am's maybe all off the top performance, but definitely Bindu ma'am and Hemant sir did a massive work. I think it was also what I felt was we are all comfortable with Hindi. So the language where you express your anger or your grief or everything, it's your mother tongue. See, if in South, it's like if you just give a role play, our housekeeping team and security will be over the top. They'll all with all big things and they are able to converse well. Maybe English as a mode of communication made us a little
softer also.
Nice.
Actually, am I now audible, ma'am?
Oh yes.
Yeah, now it's perfectly fine, sir.
So got rid of everything all year from something. I just want to add, because I have been to all kind of people, the tough ones and the very polished ones.
Yeah.
But let me assure you, even and I always give the example of South Delhi. So they are considered the most sophisticated and those kind of people. But when they come to the aggressiveness, they won't be on their body language. They will be as composed. But you will need all your skills to convince them, and their English itself in a normal tone will make you that yes, you have to like do a lot than other person who is not shouting. So that is how I.
Yeah, maybe that's true.
Good. Yeah.
On the whole, the role play was nice, ma'am. Good.
Thank you. So it was just to give you an idea that how you can handle it. See, it comes with practice. And you can actually. And it happened once in my clinic. I there was a patient who came in. We have 2 clinics. So in one clinic, the procedure is the patient will first go to my husband and then come out and pay for the consultation. In the second setup, by chance, we have kept it differently. The patient has to pay and get the slip done and then go and check. We never realized that we have 2 different styles of having patients pay. We didn't realize. So that patient had shown in one clinic once, and when he came to the second clinic, so the staff standing on the reception, she said, "Sir, kindly pay the fee." Then he said, "I'll show him and come back and pay you." She said, "Sir, here you have to pay first, and then you will be allowed to go in." So this fellow got really very, furious, and he used foul language, whether towards the girl or for the doctor, I don't know. And he threw 500 rupee note on her. Take it. That was his behavior. So he went inside, and this girl, she called me. She said, "Ma'am, there's a patient here, and this is how he has behaved with me. And he's used even a cuss word. I don't know for me or for sir, but it was very, hurtful to hear that from him." Even I was very upset when I heard this, because normally we don't expect patients to behave like this with her. So I was, incidentally, I was, right here itself. So I went down. I went to my husband's chamber. The lady was showing, the husband was her, a companion. So after the consultation was over, I sat just next to the patient's husband, and I said, "Sir, I wish to talk to you for 2 minutes." He said, "What?" I said, "You used an abusive language against my staff. Do you think that was the right behavior?" He said, "No, I did not use any abusive language. How can you say that I used abusive language?" I said, it was not an abusive language." He said, "No." I said, "Can I use this word for you? Can I use this word for your wife?" He said, "How can you use this word for my wife?" And I said, "How can you use this word for that girl?" I said, the staff who is working with us for us, they are just paid so little, but we cannot take away their respect. What have you ultimately gained by being disrespectful or using derogatory language towards that girl? I mean, we are blessed that we have everything and we can enjoy all luxuries of life. These children, they come for work for little money and respect. And I can't let that happen. Trust me, he went out and he apologized my staff. He said, sorry, beta, I misbehaved with you. I don't like, I have 100 times, used this skill myself in my personal life, professional life. And that has become my way of life. That is how I deal with everybody and anybody. So you have to first learn, excel, showcase, do the role play. People will trust your role play. Yes, sir.
Ma'am, and I also want to add on to it, like what we do best of it, but
Yeah.
we have to have the back of the mind that still there will be 10%, 20% of the people in this world, still they will not admit and they will become more aggressive, but nevertheless we should be practicing this art every time.
Assertion does not 100% assure you that you will get what you want. Please remember, the purpose of assertion is not to get what you want. The purpose of assertion is to be able to say what you want in a legitimate manner. That's all. The person may not agree with you. I'm not saying you use assertion and you get what you want. That's what I'm not saying. But when you're able to assert, most of the situations you will be able to handle amicably without, creating chaos or mess around you. That's what is the idea of using.
So more to make a viewpoint. I mean, more.
Yeah, and most of the times people understand if you stay calm, because aggression can be fueled with only one thing, and that is aggression. If the other person is aggressive and you're asserting, like Bindu said, I tried being aggressive with you. She could not be because I was not giving her a chance. The moment I had used foul language or foul tone or foul body language, her anger would have flared up and she would have gone out of control. Rather, me being calm and composed gave her time to calm down because she needed fuel and I was not giving her fuel. And I could handle. Isha, do you want to say something?
Yes, ma'am. Ma'am, anger is one issue that we find it difficult to communicate. The
Yeah.
other issues, like day before yesterday, I had to consult for my son, as you know that he is also not doing well.
Yeah.
So I went to the doctor. My doctor was not available. His son was available, and my doctor would come after 4 hours. We did not consult him. We came back. We rather waited for 4 hours just because he does not communicate well. It's just that if we would ask him कि कौन सी मेडिसिन है, कब देनी है, what is the problem, he would very rudely say लिखा है सब कुछ, and if we ask something, read it.
So
he has
Isha,
been practicing for.
Isha,
Yes, ma'am.
You play the role of the doctor. I play the role of Isha. Okay? So you said he doesn't explain well. Okay?
Yeah.
So assume that I have written this medicine for your patient. Okay? And I am Isha. So I am saying कि डॉक्टर साहब मुझे दवाई के बारे में मुझे बताएंगे, थोड़ा सा एक्सप्लेन करेंगे. behave like him.
उस पे लिखा हुआ है.
डॉक्टर साहब मैं समझ, हाँ डॉक्टर साहब मैं समझ रही हूँ कि आपने लिख दिया, लेकिन ये थोड़ी टेक्निकल लैंग्वेज है, तो अच्छा होगा मुझे मेरे शब्दों में समझा सके.
तो ज्यादा प्रॉब्लम है तो आप बाहर जाके स्टाफ से समझ लो, वो आपको या तो फार्मेसी वाला समझा देगा या बाहर रिसेप्शनिस्ट समझा देगा.
सर मैं एक दो बारी उनके पास गई हूँ, लेकिन उनको भी पूरी तरह पता नहीं होता, वो कंफ्यूज हो जाते हैं. एक लास्ट टाइम मेरी एक मेडिसिन के साथ एग्जैक्टली यही हुआ. उन्होंने मुझे बोला कि 2 बारी लेनी है, 2 गोलियां 2 बारी लेनी है, तो मुझे क्लियर नहीं हुआ कि 1 गोली लेनी है, 2 गोली लेनी. बाद में मुझे कंफ्यूजन हुआ और मुझे दोबारा आना पड़ा. आई वुड रिक्वेस्ट कि एक बार आप मुझे अपने तरीके से समझा दें.
ठीक है, मैं एक बार दोबारा समझा रहा हूँ, लेकिन उसके बाद नहीं समझाऊंगा. वैसे अगर समझाने की जरूरत नहीं है, क्योंकि नीचे मैंने डॉट बना रखी है, इसका मतलब जितनी बार डॉट है उतनी बार वो दवाई देनी है. इसको अगर आप इससे भी ज्यादा सिंपल में, तो वो मैं नहीं कर सकता.
सर आप एक बारी समझा दीजिए, मैं फिर आपको बता दूंगी कि मुझे क्या समझ आया. आई थिंक दैट विल कंफर्म कि मुझे ठीक समझ आया कि नहीं आया. इज दैट ओके?
ये 5 ml लिखा है और नीचे लिखा है 3 बार सर्कल है, मतलब दिन में 3 बार देनी है. अगली बारी 4 ml है, दिन में 2 बार है, बस.
तो मैं एक बार अपने शब्दों में
और
बताऊं.
वैक्सीनेशन का डाउट है, इतना टाइम नहीं है मेरे पास.
सर आपने मुझे बताया कि 5 ml जो है मुझे 3 बार लेनी है और उसके बाद 2 दिन के बाद में 4 ml दिन में 2 बार लेनी है.
नहीं, मैंने ये बोला है कि दूसरी दवाई जो है वो 4 ml है और वो दिन में 2 बार है.
हाँ, इस देखिए यही गलती हो
यही
जाती
चीज
है
मैं
ना.
बार बार आपको नहीं समझा सकता.
सो व्हाट आई एम सेइंग कि क्लाइंट को भी कभी कभी असर्ट करना आना चाहिए. बैंक में मैंने फोन करा, मेरे हस्बैंड ने
मैम,
फोन
he
करा.
would not listen. He would not
मैं एक
listen.
बात बोलूं,
अभी डे
उनको भी पता होता है कि ये पेशेंट चलने वाला नहीं है मेरे से. रिमेम्बर दिस. उनको भी अंदर से उनकी घंटी खड़कती है, हमें खटकानी आनी चाहिए. बैंक में फोन करा मेरे हस्बैंड ने कि बैंक खुला हुआ है चेक करने के लिए. फोन उठाया तो उन्होंने पूछा कि बैंक खुला हुआ है. फोन उठाया तो खुला ही होगा, फोन रख दिया. आई कॉल्ड अगेन दिस सेम नंबर. मैंने कहा सर 2 मिनट पहले मेरे हस्बैंड ने मैं आपको फोन करा था ये पूछने के लिए कि फोन बैंक खुला हुआ है. आई एम सॉरी समीरा, आई कंप्लीटली समटाइम्स फॉरगेट दैट आई. So my husband called in the bank to check whether the bank is open or not. He picked the call and in a very rude tone he said, if I've taken the call, that means the bank is open, and he slapped the phone. I called again and I said, sir, my husband called you a minute ago to check whether the bank is open or not. It's only after you picked up we realized that the bank is open. But you could have answered in a better way. He said, you called me to say this? I said, yes, I called you to say this, that this is not the way to behave with your customers. If I'm asking you, is the bank open? You could have politely said, yes, the bank is open, you can come. So at times when you take insult, people keep insulting you.
Ma'am, I'll give another example. Last month, yes, my nephew was admitted and we had to take him, and he's just 6 months old. We had to take him for ultrasound, and it's cold. You can imagine in the month of November, and it's he's just 6 months old. So we asked him, ma'am, sir, kindly switch off the phone because then now you have to do the ultrasound. He knows what he said. मुझे पता है, मैं रोज देखता हूँ बच्चों को. And he did not switch off the phone fan. Yeah, he did not.
That's what I'm saying. If you don't assert, then you are taken for granted.
And the child was admit for because he had a
so there are ways
and,
to give them feedback
and he
about
had a
their
severe
conduct.
diarrhea because of the cold weather.
I get your point. I think we'll be digressing from the topic.
In number of time, because it's been like 7 years, all the
then he has to be given a feedback that sorry, I wouldn't be coming back to you. Dr. Santwana, do you have to say something about the session we are going on, because then we would be digressing from the topic.
Yes, ma'am. It was just adding on to how you should become when you are a client, okay, instead of the doctor. I had one such experience wherein one of my clients was called me up and was shouting on the phone right from the start. He was a very renowned doctor. I told him, I said, can I speak to you? Can you please calm down? Let me speak to you. But he just went on and on. I just switched off the phone. I just I just ended the call. He called up again. Why did you end my call? I said, see, I could not understand. I could not hear what you were saying. So I thought there's a problem with the handset. Now I can hear you. So if you can talk in this tone, I think so I'll be able to understand better. That's when he calmed down. So good. There are times wherein we have to be very tactful.
You have to learn to assert. I think that's important.
Yes.
Dr. Samira, anything from your side you wish to say? Do we move further? Okay. So please allow me to quickly share my screen and move on to the, to complete this presentation on developing communication competencies. And there we are. Can you see the screen?
Yes, ma'am.
Okay.
Just to add on to your point, I think even at workplace, what you mentioned, it's very important sometimes to get our things done. Otherwise, you can't be very nice always. Sometimes you have
Oh.
Again, you don't have to be aggressive. Sometimes not nice does not mean being aggressive. You have to assert with your team also, with your juniors, with your staff, with your doctors, with everybody. You have to learn to assert. So if you practice this with time, you will realize that the tone of your voice communicates that you mean it and the person has to take you seriously. And that's one thing we have to do. So I think we were here yesterday when we left, about communication skills that you need to have in your, communication. And that should become your primary way of handling situation. So next is empathy. I think we have talked about it at length in the first session, so I'm not going to talk much on it. But yes, this is one skill. I think when you are communicating, if you can showcase in your, verbal and non-verbal language, it can do wonders. Like you saw in the demo that I gave you, I did use empathic dialogue sentences to communicate that yes, I understand what is your problem. I can see your, and I was not judgmental. I was understanding their feelings and I was communicating with the understanding of their feeling. Now, there are barriers in expressing empathy. What are the barriers in expressing empathy? What are the barriers?
Inability to understand the situation of the other person.
Lack of understanding. Very true.
Because we may have not experienced it. We may not have seen that kind of situation earlier.
A lot of time we have not seen it, we have not experienced it. So there's a possibility that we will not understand. What else?
Lack of training.
Lack of training, very true. Lack of training. A lot of us do not know that, this is one part of communication. And that's not taught. Very true. What else?
Dearth of words.
Okay. Vocabulary, language deficit. And yes, people are not good at expressing empathy. They don't know how to express empathy. Agreed, completely. What else?
Personality and the style of the person.
Quite possible.
Yeah.
Yes, if the person is, authoritative, even the position, if you are high in position, there's a possibility that you would not know how to express empathy towards, the other person. Possible.
There is gender difference also in expressing the things, like men cannot express the way females sometimes express.
They are not trained. Yeah. They are not conditioned to, correct. Very right. And what else?
It can, the most common which I have find is the difference between sympathy and empathy. So most of the time we become sympathizing rather than empathizing.
Very true. Very true. So, and a lot of people think expressing empathy means attaching yourself with the patient. So they fear that if I empathize with the patient, I'm attaching myself. So, it's like, taking patient's burden on self. And that's why they fear, using empathy in their communication. Poonam, you wanted to say something?
Yeah, by empathizing with the patient, we will become closer and friendly with the patient. Sometimes we are wrongly understood.
Yeah. So there's a very thin line between sympathy and empathy. Yeah, and we need to have a lot of clarity on between sympathy and empathy. So sympathy is with the person. Empathy is for the person. So if you are clear about it, that you are not attaching yourself with the patient, but you are being empathetic, you are trying your best to relieve the patient's suffering and be as helpful as you want. Another important thing is positive attitude, which we have talked earlier. So I'm not going to again spend much time on it, but definitely your willingness to engage in conversations shows your attitude. The case Isha was talking about, that the doctor was not ready to tell the medicines or explain the medicines, clearly showed his attitude towards self, towards patients, towards his profession, towards society on the whole. And it gets reflected in your behavior. Next is listening. Even in communication, as we said, listening plays a very big role. So there are levels of, listening. One is ignoring, where you just completely outright kind of, showcase that I don't care. Next is pretending, where you don't showcase that I'm not listening, but you pretend that I'm listening, but actually you're not listening. Selective listening is when you're listening to only what you want to listen. The rest of the things you just don't care. And then next level is attentive listening. We have talked about it. Reflective listening, where you listen and you also reflect. And the final one is empathic listening. I think in healthcare, we require empathic listening. We need to be clear about it. So When you are communicating with the patient, listen to what they are saying, confirm, understand their concern, and then respond, rather than responding without listening or without confirming or without actually checking with them. So some of these skills that we have already discussed, just to see once again, when they are talking, please pay attention, stay non-judgmental, show patience, because patient has to be allowed to be speak what they want to say. Your body language should demonstrate that you are listening and you are interested to listen. If required, restate to make sure that everything what you have understood is explained well. And then in case if you are not clear about anything, don't hesitate questioning. Question and clarify, rather than just keeping mum and waiting for the patient to further explain you. So I think active listening skills absolutely play a big role in communication, and we need to really re-emphasize as many times as possible, because I think this is one area which is very weak. Now, coming to the non-verbal communication, this is all about verbal communication. Now we are talking about the non-verbal. So what can you see in this picture?
We saw this in the last.
We have seen this, yeah. So from the picture, you can make out that from his expressions, he's really annoyed, angry, yelling at somebody. Body language plays a big role in communicating what we want to say, but we are not saying. So your facial expression, this also we saw?
Yes.
Have we seen this also? Okay,
Yes,
last time also we have seen. So we'll just quickly. So your expressions which have anger, irritability, unhappiness, attitude, you may not be knowing, but that gets reflected. That gets seen by the other person. So it's always a good idea to make sure that you smile, and especially if it is appropriate, you must actually smile. And if the patient is trying for secondary gains, then I think we need to assert and explain, but not become aggressive with the patient. Have we talked about all this? Okay. Eye contact. I think eye contact, we all know. We have talked a lot about eye contact. Again, the idea is when you are looking at the patient, look not longer than 2 to 3 seconds at a stretch. Because if you are looking for longer than that, the other person will become uncomfortable. So when you are staring at the person, it might be taken as being challenged or refuted. And also, if you look at the triangle, in personal relationship, you can look below the eyes. In professional encounters, you should always look above the eyes and above the eyes. So we have to make sure that, and especially when we are dealing with the opposite gender, one has to be very careful of not looking at a place that makes the other person uncomfortable. And looking from head to toe is not a good idea, because that may indicate interest or refuting. So again, that's not advisable. Posture. In this picture, there are two postures. Which one is okay? A or B?
Both are not okay.
Yeah.
Between the two, B is okay, but B shows that the person is more like who's not very receptive.
Yeah.
And A is the person is very casual. And
Exactly.
like he would not be bothered.
Agreed. So A and B both are not okay, very correctly identified by both of you. So when you want to communicate, or if you want to connect with the person, it's always a good idea to slightly lean forward and talk. So that shows that you are trying to connect with the person. The way we stand, the way we sit, everything has a role to play. For example, the clothes we are wearing. Or if you're sitting on the table, at times you will see, healthcare professionals sitting on the table and talking and laughing. People are always viewing us. People are always viewing us and also judging, by looking at our, the way we conduct ourselves in public place. So we must make sure that we have a professional way of sitting and standing, in public place. So whom does he look like?
Very
more
casual.
like a vagabond.
Yeah.
From a vagabond to a doctor.
So this is to emphasize the importance of right dressing in the professional setup. So I tell my, especially medical students, because they are young and they're bubbling with energy and they like to dress up like in the modern way. So I tell them very clearly, in your personal life, do whatever you like to do. Enjoy your life to the fullest. Don't post any pictures on social media That's not advisable, but then otherwise you can enjoy your life. But at a professional setup, if you want to be respected like a doctor, you have to look like a doctor. So you have to make sure that your selection of clothes, selection of colors also is appropriate, because wearing very bright colors, yellow, red, and jazz color is not a good idea to a workplace. So one should make sure that you use appropriate colors in the work setup. Touch, that's another way of communicating, and we all know that touching in healthcare is unavoidable, but we have to remember that we have to touch the patient with care and respect. And touch can communicate empathy, understanding, and power. A little rough touch to a young patient or a lady can communicate very different things. So we have to be really very careful about touching the patient. And we see a lot of time, when you literally hold the patient from arm and you drag the patient here and there, they feel very uncomfortable. They may not say you anything, but they feel bad about it. Again, care has to be taken. Like, for example, when you touch on the shoulder or on the hand, that's a way to communicate your care, concern, compassion, empathy. But care has to be taken if it's a female patient and a male therapist. You have to be careful not to touch the patient unnecessarily, because it can create misunderstanding. Hand movements, we all make hand movements while talking, but again, you have to be very careful of your hand movements. Sometimes it can be very derogatory for the patient. For example, I've seen patients, people saying, "Chaliye bahar, please go out, please go out." So when you show your finger, they feel bad about it. Even when you're talking about the part of the body that is sick or ill, never point out to that part of the body. It's not a good idea. So we should use hand movements with care, because it can create misunderstanding, and patient may feel bad about the way they have been handled. So a lot of time we say, "Chup ho jaiye, please be quiet, don't talk." Yes, please. Yeah.
Ma'am, just to add to this, at many of the clinics and hospitals nowadays, I've seen either they have the pictures of the particular area or spine or whatever it is, or they have models, and that's how they explain. Rather than putting their hand on the patient or something, they explain very well to the patient. So this is one way they can adapt.
That's so good. That's so good. But in most of the hospitals, I think they would still, intermittently keep touching the patient and telling them that the problem is here, the problem is there. So again, that's not a very, very good idea. But I think this is a good way to, avoid unnecessary touching the patient. This is another important thing: personal space and privacy. I think we all carry a bubble around us, and we want that bubble to be respected. So there are, times when we have to go closer than that bubble to the patient, and it can make the patient uncomfortable. But in general setting, I think we must maintain the safe distance, and around 2.5 feet distance is considered safe when you're interacting with the patient. Unless you really need to go closer, for example, for any eye examination, fundus checkup, or dental examination, where you really need to be very close to the patient. But otherwise, I think which one should maintain safe physical distance to leave the patient comfortable. Respecting patients' privacy and confidentiality is one thing I think we really need to take seriously. As of now, I think we do not care much for it. In Western countries, I think this is one of the major reasons for legal suits, when patients' privacy and confidentiality is compromised. So we have to make sure that when we are, examining the patient, we make sure that we use proper curtains and gauze, and we don't expose the patient unnecessarily. And then having a clinical meeting like this, having a patient inside and talking, and this we have seen so often in the government setup. So often we have seen this, but I think again this is not a very a welcome idea to discuss a case, making the patient center of the situation and talking about his or her case. This is another thing that we really need to emphasize, that is valuing patients' time. A lot of time we make the patients wait unnecessary, or we make them come again and again for no reason. We need to understand that it's a time lost on the patient side, but it is nobody's gain. So we must value their time, and we must value our time, and should not make them wait unnecessary. So ultimately, display of respect and care at every point of contact. I always say that patient, it's not about just the doctors handling the patients properly. Patients enter and come in contact with multiple people. For example, when they enter, they meet the security guard, then the parking wala, then again at the reception, front desk staff, then the doctor's chamber, then pharmacy, lab, radiology. So wherever they go, if they are not respected, if they are not cared, they are hurt. And everybody has the responsibility to add to enhancing their experience in the healthcare system. So we must communicate through our good behavior and respectful behavior that we care about you, we care about your time, we care about your convenience. These are a couple of behaviors we showcase knowingly or unknowingly, but they definitely interfere with your patient handling. When the patient is talking, we start looking away, we start staring, we look sarcastically, sometimes we close our eyes, unpleasant tone that we use, we start playing with phone, or we start writing something, or we start moving away. All that clearly shows that I'm not interested in talking to you and I'm avoiding you. So one golden rule of etiquette that I can suggest to all my healthcare providers is, please don't give the behavior that you don't like to receive. We all must remember that when you are in that chair, it becomes very painful. So last message is, disease and death, how it impacts anybody can only be realized once we experience it personally. I don't wish anything of this sort for anybody, but at the same time, I feel that such experiences make us more human and understanding. So with this, I think I've completed my topic on developing communication competencies. I've just tried to put in everything in this thing. The idea is that talk about all these things with your audience, depending upon what you want to focus on or what their training needs are identified by their management. So you can focus on that and develop activities around that. All this I make them do through activities and question answer and in various ways. So but this is just to give you a kitty of topics. Yes, Renuka, please go ahead.
Yeah, two things, one on a serious note, one on a lighter note.
Mm-hmm.
The serious thing, the last slide that you showed put me thinking. I lost my dad in the month of May. I just got a call in the office at 4 o'clock and telling that, he had a heart attack. He was in the hospital, and I mean, he just left. And what put me thinking after that is, we spoke about empathy and sympathy. Till then, whenever I used to get any message, my friends losing someone close to them, मेरे को ना वो right words, I used to always think, how should I express myself and how should I think? But during that 1 week or 10 days, whenever I was getting calls from my friends, my relatives, my seniors, it mattered a lot. Whatever small thing they said, whatever the way they expressed, I was more keen on, actually subconsciously I was trying to understand what they were trying to convey, what they were trying to say. And that's when I felt empathy, because many a times what happened, they were also relating their experiences, how they lost someone close and how, okay, it happened like this, and then you start listening, okay, unke saath bhi aisa hua hai. So the sympathy and empathy, till then I'm not lost. I mean, this was the first I have lost someone in my first circle, but then that was the thing. Just wanted to share that. And on a lighter note, I can teach you one Tamil saying. It's an old proverb. Samira ma'am, apart from Hindi, we have many languages in India. We have we have 28 states. I come from Tamil Nadu. We speak a language called Tamil. So there is a saying, Al Padi, Adai Padi. Can you all repeat it? Al Padi.
Al Padi.
Al Padi.
Ad Padi.
Adai Padi.
Adai Padi.
Al Padi, Adai Padi.
Okay. So Al is person. So one half is the person. And the other half is Adai. Adai matlab clothes. Okay, so it's like the personality, what ma'am spoke right now, how you dress yourself, how you carry yourself, because the impression is made in that first 7 seconds, right? We all know like how neatly you are dressed and how this thing. Samira ma'am, can I hear you say that? Al Padi, Adai Padi. She's there? Madam is there?
Yeah.
Yeah.
Okay.
Dr. Samira, she wants you to repeat.
Sorry. Al Padi.
Al Padi, Ade Padi.
Al Padi, Are Padi.
Wow.
So how we
You know.
carry ourselves is very,
It's
very,
very
very
So
important.
what is Padi? Padi is half.
Half, 50%.
half is your personality and half is your clothes. That's the importance of, I
People
take
don't know till they open your mouth, but
Yeah.
when they see you, just
Yeah.
ma'am ne dikhaya na,
First
you're wearing
impression
your
is made
coat
by
and-
how you look. Very true, very true. I take sessions for judges also, incidentally.
Oh.
So I'm working with Delhi Judicial Academy. So, newly appointed judges who are on their induction program. So I have to take session on this 3rd of January. Every time they invite me to the academy, but now we are doing Zoom sessions as and when they ask me to. So once before my session, there was a very senior judge who was a retired judge. She was, taking this session, and there was a hot argument going on, which I could hear from outside. I was sitting outside, in the waiting area, that they were saying that why should judges wear proper clothes? Why are we expected to dress up like, proper sari and everything? And that judge could not explain to that lady could not explain to the young judges. They were very young, newly appointed judges, that why should you dress up in this manner? And it was just 1 minute job, just to help them understand. See, you will be treated the way you look. It's your choice. If you want to go in skirt, in coat, go. But if people are not respectful towards you, don't blame anybody. That's all. Put the ball in their court. So same way I tell my medical students, in your personal life, do whatever you want to do. Enjoy your life. I'm no one to interfere. Only advice that I can give you, don't post your pictures on social media, because then it would bring down your social image. And at workplace, you should look perfect. That's all. So that's how you need to really, help them see the importance of proper clothing and dressing. And I take this session in a very, very long way when I talk about professional grooming. So there I talk at length, but I don't know. I can't cover all the topics here. I've just picked important topics for all of you to cover here. Otherwise, this is a very interesting topic on professional grooming. So good. It is 9:15. We are dot on time, and we are ready for the 2 presentations. Who is going to be the first one? Dr. Hemant and Dr. Beauty, both of you.
Either.
Okay.
Hemant wants to go
B
first.
comes before H, so B is Beauty.
Sure.
So we start with Beauty first.
Sure. So once again, good evening, everybody. So my topic is to use creative visualization as a facilitation tool. And I'm not going to reveal what I really want you to learn. I'm going to give you the visualization. I'm going to guide you. You have to visualize, as in close your eyes and imagine what I'm trying to tell you. And in the end, we'll discuss what did you really feel and what did you really learn from it.
Sure.
So I'll request everyone, Dr. Vindu and Isha also, to switch on their cameras. Dr. Santwana also, so I can see that you guys are doing it and your eyes are closed.
I think Dr. Santwana has left for 5 minutes and she'll be joining. So can we wait for 5 minutes?
Sure. No worries.
Because I don't want her to miss the activity. Okay,
I'm back.
Oh,
Yeah.
Great. She's there. Wonderful.
Isha, is it okay for you to switch on your camera? Just so that I know that you are visualizing. I mean, your eyes are closed.
Can you repeat, because I just missed
what
you were saying.
So just two things, doctor. All you need to do is just close your eyes, keep your camera on, close your eyes, and just follow my instructions. In the end, once we've done this activity, in the end, we'll discuss on what was your experience and what did you really learn from it.
Sure.
Excuse me, Dr. Beauty. I missed the instruction because
So you two things, you need to switch on your camera and just close your eyes and follow my instructions. Two things.
So you want
is everybody there? Yeah. So I'm just waiting for Isha to start her camera and then we can start. Isha, you there?
Isha, can you have your camera on?
We are opening one eye and seeing, is everyone closing their eyes?
I haven't told you to close your eyes yet. So you can keep them open.
They are so
For now,
eager
you
to
can
go
keep
into
them
the journey that they close their eyes.
This is my first experience with creative visualization. So I'm hoping I will also learn a lot from what we do as a group.
Sure.
Thank you, Isha. Thank you. So all of you, please close your eyes and imagine your favorite destination for a vacation outside of India. Any foreign tourist destination that you really wish to go to. Also, visualize the person you want to take along. Isha, please close your eyes and visualize this. Your favorite destination and your favorite person. So everybody, I'm just giving this instruction again because Isha has missed it. So Isha, all you need to do is close your eyes and follow the instruction that I'm giving.
Sorry. I think I need to turn off my camera, then only I'll be able to hear to you.
No worries,
The
no
network
worries. You
unstability.
turn off your camera. Sure, you turn off your camera. So close your eyes, Isha, and visualize your favorite foreign destination that you really want to go to, and also visualize the person you want to take along. Now you are on this trip. You are on the favorite spot of yours, and you have this person along with you. And you're having a really great time. You're doing all the activities that you always wanted to do. And this person really is very, very important for you, as important as your own life. You're having the best foods, the best moments, doing the best activities. Everything is perfect. All of a sudden, you see this person who's along with you starts to having difficulty in breathing. Is really having gasping for breath, is really having difficulty. He's trying to take his breaths, but somehow he's really struggling with it, he or she. That person is really struggling with it. Before you could really figure out what is happening and you try to help, that person collapsed. So he's collapsed, he or she has collapsed right in front of your eyes. They're there on the ground. You don't know what to do, you don't know anyone there. You call for help. Thankfully, somebody comes. They're trying to rescue along with you, but it's not working. None of it is working. You don't know which number to call for an ambulance. You're really worried. You're worried for his life. You're worried for her life. You really want to do anything in your capacity to save that person. You try to ask for help. You plead people to call for an ambulance. Somebody calls for an ambulance. You're waiting for the ambulance to arrive. People are asking you what happened, how it happened. Some of it you're understanding, some of it you're not, because you don't even know their language properly. The language that they're speaking isn't completely English, neither is it any of the language that you understand. It's very difficult. You are in pain, you're worried, all sorts of imaginations, all sorts of bad feelings coming into your head. But you really want to just get out of all of this, just save this person and go home. The ambulance arrives. The medical team is here. They start loading the person on a stretcher into the ambulance. They ask you for the medical history. You try to give them the medical history in the language that you know, hoping that they understand, hoping that none of the information that you're given is taken incorrectly and that harms the person. You're really worried, very afraid. You really want somebody along with you who understands you, who can help you. You sit inside the ambulance, you're taken to the hospital. You're now in the hospital. Your person is taken inside the ER room, the emergency room. You're also alongside the person. Now you see a group of doctors, nurses, paramedics rushing around to help this person. They ask you to stay out of the ER room. You don't want to leave, but then you're asked to. You have to. You sit outside into the waiting area. You don't know anybody. You desperately want answers. You desperately want to know what is happening. You don't know whom to ask. You want to make phone calls to your loved ones in your country, but you don't know what to tell them. They will have questions you don't have answers for. You're worried. You're also worried that probably you're not carrying enough money to pay for the medical treatment that's being given. But for now, you just want this person to get well so that you all can go home. Just this one time, you want him to get well so that both of you can go home. That's all you want right now. Nothing else matters. You're ready to arrange for money anyway. Nothing else matters at this time. All right, that's it. Everybody, please open your eyes. Thank you. Thank you for cooperating. So, starting with Poonamji, what was your experience and what did you visualize? What did you really feel? You're on mute.
I could visualize and feel the whole thing in a real way. And it was really, really shocking, and it can happen, like I felt that way.
Okay. Hemantji, anything you want to add?
Actually, what I visualized that thing. I'm kind of sport lover person, so visualized going to Wimbledon and the incident, and then being from the fraternity, so I was able to transport again to my healthcare domain. How generally we rush up to the ER and what is the situation, how we are actually. And then there are fewer incidences where actually I have been into that situation. So I could very well understand I was in that shoes of the person. So it was like I was transported to that level. Thank you so much.
Samira ma'am.
Thank you. I think we should think about our patient like this story. So we should be very different when we deal with the patient, different from dealing with others, for example, in a mall or in a shop. Yes. Thank you.
Okay. Renuka ma'am?
I did get into that thing. Your tone of voice and all also was very effective. So transport that panic and that situational thing could relate it, and good session.
Gurleen, what do you have to say?
It's overwhelming, to be honest.
Okay. Dr. Santana?
Well, I would say I could understand the agony of the person, of myself in that place. So naturally, as what Samira ma'am has rightly said, we need to put ourselves whenever we are going to. So that is exactly what comes on empathy. Exactly. So that's all I can say. So from the rosy picture that I could see in the initial phase with the, I think so I must be smiling broad and all.
Yeah,
and
you were.
Suddenly you told me about this, and then it was such a setback. And I could imagine that when a person is going through this, what would be the situation of the person? See, the patient is there, the patient doesn't know what exactly is happening, but the relative who's there has to undergo all the pains. So we need to understand that. Thank you.
Thank you. Bindu ma'am?
Yes, Beauty. I mean, the way you narrated, I could walk through the situation as if it is real, you know.
Okay.
I could feel it.
Okay. Isha, anything you want to say?
Till then the picture was very nice and the imagining it brought smile to my face. But the moment you said it just collapsed and this was happening, I opened my eyes. I said I cannot do that.
Oh, was it
Though
too
I was
painful for
listening,
you?
yeah, it does bring a lot of memories, so I did not want to do that.
I'm really sorry. I'm really sorry for
It's
that.
okay.
I just
So
wanted to emphasize and
I
talk
have a
about
small
fear and
question.
empathy. Yes, please, Renuka.
Your eyes were open.
My eyes?
Yeah.
Yeah, my
You
eyes.
were watching all of us.
Yes, I was.
So
I had to.
you could see some facial expressions in
So it started with smiles on all of your faces, and towards the end, I could see the sadness on the expressions of all of your faces. So I knew that you were following me, except for Isha. So
Indu ma'am, now I want to see the recording.
We'll get a link, of
so
course.
words from Indu ma'am.
So for me, of course, empathy was one part. We definitely, get that. We get to see how patients would, But for me, I could actually not visualize, but I could go back in past and couple of things that happened in past with me, which were more or less like what you were narrating. Those flashes came to my mind. So again, it would be more like empathy, where you realize how others, uh, feel when they are, in a very cheerful mood, and suddenly something of this sort had happened. And actually, I have gone through a similar experience. One day before my marriage, my husband met with a head injury,
I'm so
and
sorry.
he was to be like we had that engagement ceremony scheduled on that day, and he met with the accident. He had head injury. He was operated on the same night, and our marriage was postponed. Everything was, had gone haywire, because we never even knew whether he will live or not. That was the
Oh my God.
situation with us. Yeah, the neurosurgeon who operated upon him, he said, I'll do my best, but I cannot give you any, words of assurance that what will be the outcome. And after marriage also, it took us a lot of time to settle down, but we got married very soon, because I needed to be with him, and I decided to marry as early as possible to me. So I was getting the flashes of that incident, that okay, this is what happened.
I'm really sorry. I didn't want to really remind you or Renuka ma'am or even Santhana ma'am of anything bad that has happened. My intention was only for us to feel what sometimes patients go through, and also my idea behind this, and to do this regularly in our trainings, is to keep the doctors humbled, keep the staff members humbled, and time and again realizing, time and again being reminded of what really goes on the minds of the relatives as well as the patients.
So two things here I would like to say, Beauty. One is, as an exercise, if you're helping people learn creative visualization, it's always good to pick a happy, topic, if you want to, if that's the agenda, because people would align and would come out of it in a cheerful manner, and they've seen also. That's one thing. Second, for empathy, I do use this. Bindu knows this, because I do program on emotional intelligence, and I make people, look at their behavior. So I would normally take them to past, where they have, have behaved rudely with somebody or rough with somebody, and I make them recollect that, that incident. So that helps them reflect, and then I also make them change the color of the emotion, the intensity of the emotion. That's helping them learn regulation of their emotion. So in case if you're using for the purpose of empathy, then you can use either this technique, or if you want to talk about, like empathy for the patients or their family members, then maybe take a situation that think of that patient who is in the bed, I know, bed number so and so in ICU. If it was your relative and if you were not a doctor, just imagine yourself at different places, pharmacy, lab, radiology, here, there. I mean, that would be like every day they're seeing, but then now they're seeing themselves connected with the patient. That just, this is my, this thing.
Yeah, no, makes sense.
It was
makes
very
sense.
intense. Honestly, if you ask
Yeah.
me, it was very intense for everybody because you took us to a very beautiful place. I was wondering where should I be going. For me, Rishikesh is the best place to go with Poonam. so I don't know. Like, this is my this thing. What do others say?
Yeah, I was planning my 25th anniversary.
Oh my goodness.
No, it did become intense, and as I think Beauty was also trying it out for the
yeah.
first time, so it's
Yeah,
okay.
yeah.
But as ma'am said, maybe as a situational thing, we can
So
keep.
what I would normally say, if you want to relate the situation, then don't take a very close family member. Say that this person is related to you.
Yeah,
Don't
or maybe
specify.
someone unknown collapses and you try to help that person.
No, that wouldn't help you. What you wanted to say was that you want us to experience the same feelings.
Yeah,
So the
the
person,
fear, the empathy, the fear
And
of
if it is
unknown.
somebody who is like known to you, so your family member. The family member could be somebody like who's
Yeah.
very close. Something we don't want to think of them in that situation.
Yeah. True.
That's
You
the
could
Absolutely.
important.
Or maybe
generalize someone. Like Dr. Indu had a flashback of
Yeah.
uh, quite a past thing. Like in my recent past, in January 2021, my husband was very critical. So I know all those memories.
Yeah.
So recent past, and जब हम वो रोल प्ले भी कर रहे थे डॉक्टर हेमंत और मैं आपके साथ, वो भी मेरे साथ एक्चुअल में हुआ था. वी वर जस्ट, हम हॉस्पिटल पहले गए थे, टीएलसी बढ़ता जा रहा था, उनको कुछ समझ ही नहीं आ रहा था, and we had to shift him to Gangaram, and that was a long fight with them. कि हमें जाने दो यहाँ से, and I mean it was all
I can understand. Dr. Santana wants to say something.
Yeah.
Please.
How is he now, ma'am? He's better.
Fine. Shoot.
Thankfully. Yeah, Dr. Santana.
So, ma'am, we all agree to disagree. So, on this point, ma'am, I would say that what Beauty has given us an example. This example is really, it could hit hard a person to understand that yes, when a family, a person, or the patient relative is in such a situation, then what could happen? You imagine when you are in this position.
Yeah.
So once you learn that, the clinician would become much more thoughtful about when they act or deal with the patient relatives. And Beauty, I would just like to put a suggestion to this, that whenever we are giving such a role play, I agree with you on this. I'm sorry if I disagree with others. My humble apologies. But if we can even give them that how the situation can be handled.
Yeah.
Okay.
I was thinking to add a happy ending, maybe.
Or maybe
add
like
something
how,
that is more
how
light.
the patient relative
Dr.
can be
Santana.
managed at such time.
Dr. Santana,
Right.
being a trainer, we have to be very careful. Sometimes when things misfire, your whole program can go haywire. So this is from my experience I'm sharing with you. Be very cautious of using your activities. Anywhere, if anything goes wrong, people can go against your program and you will not be able to calm them down or bring them back, because see, you would like to do this with people who are in position, and people in position can completely what I normally do this with consultants, because I know that they have to be brought to a point where they get to realize that because you are healthcare professionals, so you can get anything at the click of the button, but not everybody. So I talk about that case patient Ram, and then I say, imagine this patient Ram is a relative of yours, and I make them close their eyes and I make them visualize. I've seen people literally crying in tears. But when I say, but I don't take them from a happy moment to a sad moment, so that shocker is avoided. And second, I don't make the patient a close family member, like your immediate family member.
Yeah.
I keep it like, imagine this patient Ram, 65 years age, is related to you. So for them, imagining for somebody who is older in age is still acceptable.
Right.
You're imagining your life partner or your child, or so you have to be very cautious in using this. In it can misfire. It can. So I would not agree with Dr. Santwana on this. Yes, the idea is to hit hard, but then with care. With care, it should not come back. That has to be kept in mind. Dr. Samira, I want you to give your thoughts on the same.
Yes, I agree with you. She took us to a very nice place. Then suddenly a very shock status. Yes. So I think also no need for this. Only just say, suppose that you have a relative and
who is admitted.
yes.
I normally, what I do, I take them to the attendance journey. I tell them that the patient is in ICU. You're not allowed to see. The doctor is not wanting to talk to you. The nurse is not letting you in. The security guard is very rude. They are all the time asking you to go and get the medicines. You are going to the pharmacy. You have gone with some amount of money. The list of the medicine is too long. The amount of money that you needed is not enough that you have. So, I mean, I take them around in this manner. I ask them to visualize, and then I even take them to the night time when there is nobody around, there's no place to sit. You're sitting on the sofa or chair, and it's very cold, and you just have one, small shawl with you, and you have to. So just that much. I mean, and then I ask them, how did you feel? And most of them say it's very, very, scary to think ourselves into that position. So I mean, I would say be very, very. But I am happy, Beauty, that you did this. So we have been able to discuss even the risk involved in creative visualization.
Yeah. No, I think two learnings from me, from the point of view of conducting this as a session for a group.
Yeah.
And the group can also have people who are highly emotional.
Yes.
The group can
People
also
can
have
cry.
people.
Can.
Yeah. No, I visualize. I can imagine that this can really go wrong. So maybe so two learnings. One is not having two such extreme emotions in the same visualization activity. So that can be one learning. And second one is not using somebody really close to show that, I mean, this can only go wrong with that person, right? So this can go wrong with anybody. So
Wonderful. That's a wonderful learning.
something.
Wonderful.
Yeah.
I really appreciate. So I want to also bring in here in NLP, we use the creative visualization extensively for positive outcomes. So for me, this book was, planned in my NLP program, where my trainer, took me to a point where the book is ready. And then he made me imagine what are the first step, second step, third step, fourth step, and final step when my book is ready. And he made me even look at the book, that this is your book. Tell the color, tell the size, tell the shape, tell the weight, all those things. So he made me. So usually creative visualization is used for the purpose of having, planning something and making it happen. So it's more like, we always say things happen twice, once in your mind and then in the reality. So we use it in that. But I think this is a wonderful way to use to, teach people empathy and make them more, compassionate towards patients and their family members. Poonam, you wanted to say something, I think.
Yeah, I wanted to say Beauty has done the activity in a very wonderful way.
Yes.
I could go to that path exactly she said.
Oh.
All the instructions were so nicely conducted by her. Yeah. Her tone,
language,
language,
no doubt,
consistency, pause, that were excellent. Even though the content we are disagreeing, all of us.
But the delivery was
few. But the activity conducted by her was excellent.
Wonderful. I think you did it very well.
Yes, very well done.
Very good learning for all of us. Very good learning.
Very well.
Thank you. Thank you.
Thank you. I think that's the purpose of having these skills being discussed like this. Everybody is on the same page that this is how we should be using it. You should be using it. It's a wonderful tool. I use it very often with senior consultants, because to bring them to the ground is you need to pin. Like Dr. Santwana said, you must hit them hard at a softest place. Okay. So we have the next presentation. Thank you so much, Beauty. Thank you. Wonderful. Good learning.
Thank you, everybody. Thank you, ma'am.
So Dr. Hemant, it's your turn, and exactly 15 minutes at your hand. Go ahead.
Ma'am, good evening. And uh, when there are so much seasoned people and who present those things, the bar is kept high. So again, it's not an easy field to like present your things. But again, I think the tone has been set very high, and the topic which I have chosen is very close to my heart, is experience sharing. Because in healthcare, what I have felt, it's all about humans. And humans are always able to relate mostly with the bonding, which can be only through experience. And why experience is required? Because in our lifetime, it's really impossible to experience everything. By sitting here, I'm sitting here, and I can by the experience of Dr. Samira, I am able to learn what is happening in Iraq and other places around. So while experience sharing, there are few do's and few don'ts we should. So experience sharing always have a take home message, a learning kind of a thing, where with your experience you are able to transcend, and for the right message which you actually want to denote the learning point of it. It can be sounding not too pleasant every time, because we are in that kind of a profession, always dealing with intense thing. So I always say, in the hospitality service sector, education, hospitality and healthcare, we are the people who has to deal with the people doesn't come with the right frame of mind at this thing. So we ourselves are drained with most of the time with situations we see around. So again, it takes a lot of this thing to keep yourself happy and to do a professional this thing. So whenever we chance to get learning from experience of our seniors or this thing, we do take. And wherever we get a chance to transfer to the newer ones or the younger ones and who have just joined. So this is what another thing which comes to my point is few don'ts we should not, like while sharing experience, we should try to generalize one thing, like in a metro city, in a networked hospital. So if we talk about Fortis or Medanta or Apollo experience, we should avoid saying it happened in Medanta, because we all know Medanta refers to Delhi Medanta most of the time, though they have got branches otherwise. So we can say in a leading hospital of the country, of the capital. So, and a network hospital also take the same message. Then we also should see the audience which is sitting in front of us. So we should always should not try those words which are able to communitize, like nursing profession has got these issues. So the whole community becomes, and you as a trainer, your program can be sounding disinterest because they say this person has come with a biased approach. So
stereotype and biased.
yes. Or one of the things which I have seen a lot of, we have got perceptions, government, private, corporate, clinic. So again, this acts as a prejudice, because in government sector also, I've been in COVID, and 2 years I have seen people losing their lives and this thing. So when such comments come or the experience, so again those people come ki, no, people are good over there, and it's like, so these are the small things which we should feel while sharing experience. We should have a balanced approach, so that ki everyone feels ki okay, the things can happen at any place, and then the outcome should of it. There are many experiences which I have, and which can share with good happy endings and with pleasant memories. But as for the essence of the situation, what master trainer program we are going in, and communication skill. So I would like to share one experience, and I would like to Dr. Renuka and Dr. Beauty and Dr. Poonam ma'am to think about Dr. Renuka ma'am to what could have been done to salvage the situation which happened, which I'll narrate the experience, and Dr. Beauty to does it happen oftenly with her experiences and what they have heard, and Dr. Poonam ma'am, to see that what kind of training things for different stakeholders in a situation we can denote. So these are the kind of things which can be enriching for the experience.
Yeah.
So during COVID pandemic, the healthcare system was under a lot of stress, and even the junior doctors, like in war situation, the trainees are sent to the in the war front, and they are not fully trained, but they are sent into that situation which is very draining and for them. So for junior doctors, it was a very difficult phase to go through. They have come to do their specialization, and instead of learning surgery or orthopedics, which they have toiled so much, and they were sent for doing a COVID duties. So for a medicine resident, it was fine. But what was for a skin a resident or a dental or this thing? So again, that kind of a thing happened. So a patient gets, I'll just share the experience. A patient gets bed in a government territory in second wave of COVID, where there was a lot of this thing for scarcity of oxygen and the injectables and other thing.
Yeah.
Somehow he gets in, and doctors do their best, and he gets well. And a day before his discharge, he's told that you are doing fine and you will be discharged tomorrow morning. And the doctors were put on a roster. Every Monday, the junior doctors' shifts used to change. So when they used to come, for them to handing over patient was done, and to understand the whole process, which was entirely different, because they could not go to other places once they don PP kit and all. So they could not go to the front office or other places. So the morning, the new team arrives of junior doctors who manages the flow, and this patient, there was a bit of delay in discharge procedure, and this patient picks up a fight with a junior doctor, abuses him, and then things go haywire. I, being in the management, I get a call that at the reception area, the resident doctors have taken hostage a patient, and they're not allowing him to go. I get a call from security and front office. So the situation was there. On one side, we have got our team and the whole team, and we can understand when the junior doctors get together, they can stop the whole hospital functioning. Yes. So it will come to standstill. So the everything got come to and standstill. And so I had my agendas clear the moment I got time, and when I went there, so one of the doctors and I went there and I asked what actually happened. And the doctor narrated that the patient has used those words, abusive words, threatened to hit him, and those kind of things. And they were doing duties for so much months that they really could not tolerate. And they said we will not allow him to go, and will not allow any new admissions to be done. So that kind of a situation. And I wanted that management should take some action. Some action. And then I took the doctor aside and told, I understand your plight, and I have been here for more than 1.5 years and working like what you do. And don't worry, I'll get this sorted, and I'll ensure that this patient doesn't behave like this with any person in other. Leave aside doctors, and be rest assured, I am here for you, and don't worry, everything will be restored. And then I took the patient aside, and I asked what actually happened. And he said, I lost my calm, and I was told by the doctor that I'll be discharged, and it's already 6 hours, and I have not been discharged, and that's it. And finally, I called in police. So when the police came, and I told doctors, please go to your place of work, and this person will get his dues happen. So because the police was not called, So there was a routine security. So when police was called, the first sign of action was there, and as I was doing the rounds daily and understanding the needs of the junior doctors, what actually medicines or injectables or whatever the things, and they are concerned to the higher management. So they trusted me and they went back, resumed the work. And for the police person, I told him that see, he comes from a very well society and good political connections, but yes, he has misbehaved with my doctors. So kindly take action. Like took him to the police station just across the hospital, get him an apology written, and give him a warning like such, and she should not repeat with anyone else in this thing. And that's how the situation was. He went in, the patient also said sorry and given an apology letter to the hospital. I made him write and he has given, and then the police also this thing, and he was then let off after giving that. So my learning and which I shared, and there were certain such situations. So I would like that these kind of situations do come and test your all your skills, where you have to see the patient side also and the doctor side also. So I would like Dr. Renuka to go ahead and say what actually on the task which I have given. So for enlightening for all information knowledge to all concerns.
Thank you, sir. And I am the bakra for the day. So I will start. I did get the story, but the task given to me is you have changed the story at the end. The salvage part you have told me that I have to do. What is the salvage part? So
what could have been done to salvage?
What could have been done?
Yeah, what could have been done? Yeah.
I am still not comfortable with the concept of calling the police and then making the patient write apology letter and all that. I don't know if that was the right way of handling it. That is to my knowledge and understanding. I don't know how senior administrators really work, but I feel that would have instigated the patient and family even more. And if it was a COVID patient, definitely we wouldn't have even touched. I mean, the situation was so.
You'll be infecting more people. No, but he was COVID-free. He must have been negative by then.
True. All our calculations would have gone this thing. So I think you have handled it well as regarding your junior doctors. You have handled them and made them explain to them very well. And the patient part also, you have spoken to them. But apart from that, I actually didn't go with the police concept of it. I hope I'm okay with that. If you have anything, please correct me. I'm just this thing. Yeah.
So, Dr. Beauty?
Yeah, so my task was to answer if this happens often. I haven't really come across a situation where doctors keep a patient hostage and you're able to call the police and this works out in our favor or the hospital's favor. This may actually become more of a media and press issue, and then things can really go bad if the patient really is from an influential background or has political connections. So that's one aspect. What I really wanted, I mean, I was curious about knowing why was the patient not discharged on time, and what did you do about it later on? Like, did you take a corrective action to make sure?
For it?
Yeah, and also there was a mistake from the doctor side that the patient was not informed. I agree. I mean, why was the only patient made to write an apology?
So can I summarize at the end, or can I in the between also?
Yeah.
So maybe you can answer Beauty's question, but let's keep it short, because I have, I want to talk about this pedagogy in a little bit about it, and I want to share my experience with it. Yeah, please go ahead. Yeah.
The setup which involves here the reasons behind it, why these kind of situations happen. So this was a government setup. So there is a lot of issues of violence reporting and doctors at the receiving end. So it had a national media also. The attack was done in Indore, and the videos were countrywide. The first incident,
Yes.
and we faced a lot of attack and mob this thing and that way, and it came to the point where it was that there was no security for healthcare professionals. Their life was at risk, and even the people were always overwhelming, and the doctors were so this thing that they feared for their life. So the sight of a policeman in there, this thing was a kind of a reassuring thing, and people went to that lengths to abuse a doctor, to hit them. So just writing a policy was a face-saving measure at times, to with a milder kind of a punishment. The laws are like you could be prison behind it. It's a non-bailable, like it's a offense is there, and your legal action is there. So you want to try to solve this from a patient end and from a doctor's perspective also. So that's why you want to have those kind of, as a administrator, as a management, and when you want that hospital should run and patient, the things should not come to a standstill. And when these situations come, everything stops. Everything stops in that kind of, and you don't have the protection of security and thing for your people. And most of them are nurses and female doctors, so it becomes very tricky for them. So the reason why I said it's not a structured setup, like you have got a proper front office, then you have got people who work after discharges to look after patients. So, and when I have told in story that every weekly the shifts change, the doctors are new, they don't know about the patient, for how long he have been, what is the nature of those cases. So it becomes very, very difficult and challenging, ma'am. So and I want to add, like this have been a very normal case that the doctors generally say on the evening rounds that you will be discharged tomorrow. Even in a corporate sector, most of the conflicts happen once during admission and once during discharge. These are the two things where you got a lot of the complaints. So if the discharge process is smooth, then everything is gets well. Otherwise, you give the best of the treatment. If the discharge process is not smooth, you will.
And usually discharge is late; it gets delayed for hours, and then patients are really,
hours and hours. So generally, it's advised. We had a meeting and with doctors, we say never say that tomorrow morning you'll be going home. So again, you come to morning rounds and you say you can be discharged, and because after saying also it takes average of 3 hours for discharge process in that.
And I think we should also communicate the time that it will take 4 hours or 6 hours. I think if you communicate in the beginning, then they are clear about the expected time of discharge. The confusion happens, we say discharge, for them they don't know what are the formalities to be completed before the patient can actually be discharged. So if we can tell them that it takes around 3 to 4 hours to complete all the documents, so you will be discharged by 4 o'clock in the evening. So they are mentally aware that, okay, or in case if they have come from a far off place, then they know that we will not be able to go back at 4. So they will request you that please discharge us tomorrow morning, because even if we leave at 4, we can't reach home before 10 or 11. I think that discussion has to be done. So anything for Poonam that Poonam, you were supposed to be.
Yeah, I was given the task of training. Just I'll take a few seconds. Soft skill is the most basic and important training for every cadre of people. Like from in a hospital setup, for all level of people, soft skills, which we don't generally teach them. Actually, every human being should be taught from the beginning only, at the school level only. Under life skills program, they should be taught soft skills. We always teach them so many technical skills, advanced skills, and everything, leadership qualities, everything. But the basic soft skills are not taught anywhere, which is most important. And at every level, on day-to-day basis also, at the smaller scales also, we can teach them. At in a smaller groups, these skills can be taught. This is one of the most important thing. Yes, Dr. Indu, you can carry on.
Yeah. So very quickly, I want, because it's already 10:05, I want to talk about this pedagogy as a facilitation skill. So experience sharing is a wonderful pedagogy to engage people. Also, especially the kind of clientele you're going to interact with, most of them will have a lot of experience to share. And if you're able to engage them by making them share their experience, so not that we have to only share our experience. If you can create a situation where you ask people to share their experience, one, you will get a chance to listen to what they are thinking or what is coming from where. Hmm? And then when they share their experience, they get engaged as an audience, and they feel happy that they have been able to talk and they've been allowed to talk. So as a facilitator, it is not that we have to do all the talking ourselves. It is making people speak. But yes, sharing experience has to be very carefully facilitated because it can go haywire. So you'll have to you have to pick your person whom you want to share the experience very carefully. So sometimes people who are very close, if you ask them to say, you are in this department, so do you have anything to share with us that will enhance our learning? So people would open up. There are people who like to do a lot of talking. So in between, you will have to give them that chance to speak. Only then they will be able to allow you to, continue with your session. So giving them chance to ask by asking them that I think you are working in such and such setup. So I'm sure you can share your experience. And then also you can use them as a co-facilitator. But then of course it requires a lot of experience. Otherwise they can hijack your session. So you have to do it very, very carefully. So again, striking a balance where you give them a chance to speak or also, control so that others also get a chance. But it's a wonderful pedagogy and it really brings a lot of, input from people. And people actually come out with a lot of, learning from their life, which others are very quick to adopt and use for their professional and personal life. It's a wonderful tool, but you have to be really, really good at handling it because it can again misfire. That's my understanding of experience sharing as this thing. Gurleen, you wanted to say something. Please go ahead. Yeah.
Ma'am, can I share when I've used this in the class?
Sure.
There's a lesson that I did on appropriateness of language.
Mhm.
And what I did initially was I asked all the students to take blank slips of paper and I asked them to write down a question, the most embarrassing question that a health professional has asked you, and why did you find it uncomfortable? And then we collected all the slips, and I intentionally asked them not to write the names on it. The second part of the lesson, and I told them that we're going to revisit them later. The second part of the lesson was where I introduced this concept called indirect questioning, which is about using some softener phrases, just using them prior to the embarrassing questions. For example, in some cultures, it's considered inappropriate to ask, are you married or do you drink alcohol? So we ask, first we give a rationale for why we're asking this question to justify the line of questioning. And then asking the question, I'm wondering if you can tell me if you consume alcohol or something like that. And then at the end, I distributed those slips of paper and I asked them to use indirect questions to transform those embarrassing questions into indirect questions to make them more comfortable for the listener. So would this be a good example? I'm just sharing this to ask you if this is a good example of experience sharing.
So experience sharing is more to do with if somebody has seen something or has gone through something.
Okay.
So bringing that experience here for reflecting and learning from that and also getting others' viewpoint on that is the idea of experience sharing. So for example, if I say, has any one of you been through a situation where you were really, really upset and there was nobody to help you? And if you would like to share that experience with others, they'll be able to understand your this thing. So people will say, okay, when I was a child I had this issue, this. So one is they are able to relive this, and then it relieves also. Especially the painful memories get relieved when you are able to channelize. And if any one of you have attended landmarks programs, I don't know, Landmark is an international organization. They work on the concept of mass counseling. although I don't approve of their technique. I have attended their preliminary session, but I was really, very upset with the way they handle. And I sent somebody to attend the complete program, and that person came back very disappointed. There, they make people talk about their experience. For example, people who have been raped or traumatized or have been victim to domestic violence or have seen, bad, situations in life. So they make them talk in front of people, and there are around 200, 300 people in the hall. In front of that, you share your, agonies. I'm not in favor of that, because that does not, you feel so embarrassed to talk to everybody and anybody about it. But that's what they do. They make you share your experience. So the idea is, if you're trying to make a point and you think by when people will share their experience, it will be kind of validated. So, for example, if I want to say that, I mean, a lot of time people do not, understand our need, especially healthcare providers. Sometimes they're in too much of hurry to, to look after the clinical part, that they don't handle your. So, has any one of you had any experience of that sort? I'm sure each one of you will share your, like just now Isha started, Bindu started, Renuka started, I shared. Everybody had something to share. That is experience sharing. Had I just said that all of us misbehave, all of us do not act responsible, nobody would have agreed with me. But I created more votes for my concept by making people speak. That's the idea behind experience sharing. Does that clarify, Kurleen?
Yes, sir.
And do you agree? And do you agree?
Of course, yes.
Wonderful. No, we are free to disagree. Not that what I'm saying has to be agreed upon, but
I do agree. Yes.
yeah, this is my understanding of using experience share, and I use it a lot again with care, because you need to be really careful in using this technique and having more people on your side, because a lot of time when you introduce a topic, people may not align with you. So they are making people speak with you would also help you to consolidate your position in the program. So initial few minutes are just to stabilize you, and then you can take a flight. That's the idea. So any questions, anything anybody wants to ask? Dr. Samira, I want you to speak, because most of us do a lot of talking and you really speak very little. So I really want to.
No, thank you. It was wonderful. Thank you very much.
I hope it made some sense to all of us and to you especially.
Yes.
So I mean, even with the medical students, we can use this.
Yes, I actually use it.
Okay.
When I explain for them patient perspective, what's patient's perspective? So
Yeah.
I say everyone, if he has previous experience, he become ill or his relative, what
Yeah.
happened or how they handle you in hospital. Yes.
Mm-hmm. Yes, completely, agree. And I use this often for the program, so that's a wonderful way. So just last 5 minutes, because for the last two sessions we have been keeping it pending. Dr. Samira had asked me a question about how do you ask questions about asking patients' expectations. I know, because in Western culture, very directly we ask the patient, okay, so what are you hoping to get from today's session? And I think we are not used to this kind of questioning style with the patient in our culture, whether in India or in Iraq. I think that's what is our concern. So you may not ask a very direct question like, what are you hoping to get? But I need to know what is my patient expecting. So you were getting your treatment in that hospital. So what brought you here? I would get an idea that the patient might say, I was not finding their treatment very effective. They were not dealing well. So I'm hoping that I will be able to get better service here. I have an idea about now what the patient is expecting. Okay, so you have a lot of you have really given me a long list of things that you want to talk about. Is there anything particular you want to talk about? And what are what are you thinking we'll be able to get out of this? Then you get an answer from the patient. I have so many these things, but I want you to tell me about what it is, and I want to understand my disease pattern or disease outcome. So we don't always ask a direct question like it is written, what is your expectation? But I have to design my question, modify my question in a manner where I get to see what is my patient expecting. So even when I ask them, okay, this problem has, the surgery is the only option. Are you okay with that? Because there's no other way out. So the patient might say, no, I'm not wanting surgery. So I'm getting an idea. The patient is expecting medical intervention and not surgical intervention. So I need to now take it further by explaining why medical intervention in this case will not work. So this is how we kind of, find out what is. And in this case, I think one thing very clearly, which I focus on with the medical student is, if you identify unrealistic expectation, do not leave it unaddressed. Make it a habit to talk about it. If the patient, if you ask, okay, so what are you hoping? What will you be able to do? I think once I'm operated, I'll be able to run up and down and do everything. Then probably, yeah, you'll be able to do it, but then it will take you at least 6 months to 1 year. That means I'm toning down the patient's expectation. Do you think that helps you, Dr. Samira?
Yes, I understand. Thank you very much.
Thank you. So with this, I think we come to the end of the 7th session. Yes, Dr. Renuka.
Ma'am, about the next class. Sorry,
Yeah.
because
I know.
4th I'll be. And for me, sudden plans.
Dr. Samira has 2 hands, so she has more 2 things to ask. Go ahead.
No, ma'am. I just wanted to say that today we have not clicked the photograph.
No, we were waiting for you to come. I remember, and we are going to take a picture. Only thing is, Isha and Bindu, can you have your cameras on for a minute?
Bindu also is missing.
Yeah, Bindu and Isha. I think Bindu has left. No, Bindu is there. Bindu, aa jao bhai. Chalo, anyhow, I think we'll take a picture. If there were aa jayenge, we'll take another picture. So everybody smile. Thank you. So about next session, today is 29th and Wednesday. So when do you want the next session? Initially, we had planned for 4th or 3rd? 4th. But Renuka is traveling on 4th. So can we have it on any other day? Because I don't want any one of you to miss any of the 3 sessions, because we are going to cover important topics. Let me tell you what I'm planning to cover. Give me a second to have a look at the list of the topic. Okay. A very important topic is handing over tools. Very important, and we are going to talk about how do you go about handing over, and why it is important, and what actually happens, and how the information gets lost in that process. We are going to talk, and we are going to talk about a couple of tools, handing over tools. Although I've given you a booklet, I would request you to read about that topic and come when you come for the session. Then the discussion becomes more, substantial. So
we can have it on 3rd.
I'm okay with 3rd. Are you okay with 3rd, Renuka? Tell us.
I'm traveling on 3rd night. 3rd, 8 o'clock I'm starting.
Okay, 3rd you are going.
5th morning I'll be back. So for me.
When will you be back?
I'm back on 5th morning, ma'am. I'm going to Bangalore for a day.
5th morning. So are you okay with 5th evening?
Is 6th okay, ma'am? Sorry. I mean, if it is okay, 6th I can.
6th also. For me, 6th should be fine. What about others? क्या day क्या है 6th को?
Thursday आ रहा है, ma'am.
Thursday. So how is everybody placed?
Is it okay?
Dr. Hemant wants to say something.
Ma'am, I have an admission process for the institute, so it will pack up will be late. So okay. I'll be missing that day completely.
I don't want anyone to miss now any last 3 sessions. I'm really surprised that we're just left with 3 more sessions. We've just begun. I mean, I have this feeling.
7th is okay, sir, for you? 7th? How?
It will be a big.
Sorry?
Saturday.
7th is Friday.
It will be a long gap then.
Yeah. More than a week, about 10 days.
So would you like to meet? Would you like?
What about tomorrow? Tomorrow.
My husband will kill me. I come from hospital, sit in the bench. He was heating up today in the kitchen.
I'm okay with tomorrow also, and 5th also.
So who is this entering? Is this Isha?
No, ma'am.
So iPhone entered the waiting room. Who is this? देख लेते हैं कौन है.
Must be Gurleen. Must be Gurleen. She's missing.
Ah.
Okay.
Oh, maybe, yeah. And she was working from her office, you know. Sorry, Gurleen, I think you're still in your office because of us.
Are you asking me, ma'am?
Yeah, yeah.
Yes.
Sorry. So, how about Sunday?
Sunday is okay. Me, it's okay.
This Sunday.
Second?
No, ma'am. No.
बहुत सारी नो आ गई. कहाँ से आई ईशा? इतनी सारी नो एक साथ.
I'm fine with any of the days.
No, I'm not. Please sit.
That was Bindu ma'am telling no.
Okay, listen. I'll start
It
from
was
date
me also, Isha.
2nd January and I'll keep asking you. Raise your hand. For 2nd January, how many hands raised?
Ma'am, the time, if it can be earlier, like Sunday 8 to 10 zaruri nahi hai na evening, so
Then I can keep it early. I can keep
No,
it
she
early.
doesn't want it early. I think
No,
Beauty
I want
doesn't.
it early. I want it early.
You want it early. Okay.
बोलो.
It's okay.
Sunday 11 बजे रख लो. 11 AM.
Okay.
I'll be at the airport, ma'am. I'm flying out tomorrow.
कहाँ जा रहे हो?
I'm going to Dubai.
ओ? तो फिर बोलो. गुरलीन, अब आप बताओ आपको क्या टाइम सूट करता है?
Anytime after Sunday, I'll be back on Sunday night.
अच्छा, संडे सूट नहीं
Renuka
करता.
ma'am, 5th will not work for you, kya? 5th.
5th only I'm back. I eating. Okay, otherwise 5th evening we'll keep it. It's okay.
5th rakhte because otherwise it's becoming too long.
Because 2nd you are saying everybody's okay, but Gurleen is traveling, so we will miss her. That's not a good idea. 3rd, you are not okay. 3rd, how many
3rd I'm
people are-
traveling.
3rd
I'm back.
3rd and 4th she's traveling.
3rd she's
I'm
going.
Tomorrow.
Tomorrow she said
No.
her husband.
I am okay.
Yeah,
I am
No,
okay.
ma'am. Please go.
I think 5th then works out for
I think so.
almost
I think
everybody.
so. Although I have a session on 6th morning for a hospital, but I think I'm still okay. For me, I think I'm fine.
Okay, ma'am. We'll keep it as 5th.
5th, I think 5th is fine. Isha, are
Yeah.
you okay on 5th?
Yes, ma'am. 5th is okay.
Okay. Thank you so much, Isha. Thank you. Hi.
Yeah, you have to ask your children.
Standing next
So
to
true.
laptop, and when are you ending this session?
Oh my goodness.
My son is outside the door. Oh, yeah.
Beauty is also waving. Wait, 2 minutes. Okay, I think we'll end it. Thank you so much to all of you for being so patient and so engaging and so interested in this session. It's 10:20, I know, and you must be hungry to have your dinner. So see you on. I have not shared the feedback form. I'm sharing in the WhatsApp group, but tomorrow I must get the feedback form. Please,
Fine.
Bindu.
हाँ जी मैंने last 2 times का करा है.
Thank you. Thank you. Thank you so much. Okay. Bye-bye, everybody. Good night. Thank you so much.
Sleep
Bye-bye.
tight. Bye.
Happy New Year in
ma'am. Bye,
advance.
Vanessa.
Yeah, Happy New Year to
Yes,
all.
Happy New Year.
Happy New Year.
Happy New Year. See you in New Year.
Bye bye.